Good evening, everybody. Welcome to Dr. Sharma Show. I'm your host, Dr. Sharma. I am a functional nephrologist and metabolic health expert. If you're looking for any health-related advice, then this is the right channel for you. Today we have a special guest, Shefaly Ravula. Her background is as a PA, is also a functional medicine expert, and is a visionary founder of Precision Gut Health. It's a virtual telehealth practice on a mission to unlock the secrets of gut health, nutrition, and longevity. At the heart of her practice lies the powerful fusion of functional medicine, culinary nutrition, and profound commitment to digestive and metabolic health optimization. So we'll be talking with Shefaly shortly about the gut health and longevity. So I think it should be okay. We can get started if you're ready.
I'm ready.
So Shefaly, I was telling everybody about your background. Why don't you tell us more about how you get started with the gut health and precision gut health, your practice?
Absolutely. I'm a conventionally trained PA and did a lot of conventional gastroenterology for years. So that's really how I got into gut health, but from a traditional perspective, right? So I think that's really important, staying in tune to what is needed on a conventional medicine level, and then taking it one step further by expanding beyond and looking at an integrative, holistic approach, paying attention to the entire connection of the systems of the body. So that's really how I got to where I am, doing more of this sort of holistic piece. However, there was more to the story, as always. I got into culinary medicine because I became a cooking instructor and was teaching Indian cooking, believe it or not, for a long time, for a while, and slowly realized, I need to do more nutrition, more functional medicine, and sort of it came full circle to this. And why did I get into nutrition in the first place? Which actually I got into that many years ago, before I even got into GI, and that was my dad's heart health. And South Asians tend to have a lot of cardiometabolic issues, and he certainly did. And that really led me to wanting to study nutrition, which really was related to cardiometabolic health and cardiometabolic nutrition. So that's kind of parallel with the gut. And, really they can go hand in hand, not always. And we don't have answers to everything still, but, that's where my passion is. Yeah.
Wonderful. Thank you for sharing your story from your dad. Everybody has a story, and something or the other, especially when the family members are involved, they inspire them to become look outside the conventional medicine, look for more answers with the root cause, to the root cause problems, and functional medicine actually gives that answers. So I'm glad that your journey is pretty much similar to mine. Now we are celebrating this month as a mental health month, and I want to know from you as an expert to tell us more about how the gut-brain axis and what is the gut-brain axis first of all, and how it impacts the mental health and cognitive function.
Yeah. So, of course, again, there's not a lot we know, but there is a lot we know. So we know the just basic physiology of the autonomic nervous system and the balance of the parasympathetic nervous system, in balance, in hormesis with the sympathetic nervous system. And so we can tend to live in a fight or flight state with an overdrive of the sympathetic nervous system and not give our parasympathetic nervous system a chance to really do its job. And that, there's certainly innervations throughout the GI tract. We have some nice diagrams in our course materials here that explain that, and this very well in functional medicine as well. there's communication from the gut to the brain and vice versa. And, that is an afferent and an efferent nervous system pathway. So there's a lot of communication from the gut to the brain and vice versa. And so I would say that's kind of at a high level what we know about what is the gut-brain axis. It's totally a communication system through the nervous system. There's hormonal regulation as well and hormonal communication as well. But that I guess that's a simple way of putting it. So one of my favorite tools for people that have gut health issues or fight or flight issues or both is really starting to work on that nervous system regulation. So it's so important, and there's some really cheap or free things people can do, working on eating hygiene and slowing down eating and not rushing through our meals. I'm guilty of some of these things too. We all are, but to be mindful of it and try to incorporate these habits are really important. So chewing really mindfully, breath work before meals, even a few breaths, breath work when you're in a car at a stoplight, like put these habits into action, and like trying to like quiet and calm things down is really important. And it really does help to do that during meals as well.
So, we like often see our kids rushing through eating the food. So it's really activating all the senses, right? Seeing the food, smelling the food, and then tasting it is actually gonna improve your digestion from your salivary glands in the mouth and activate them to help with the digestion of the food particles which are going into your stomach. And then from there on, you're activating all the enzymes to digest that food. So that's kind of a nutshell of being mindful about eating and slowing down.
Triggers satiety sooner. So, you will probably notice that you'll get full a little bit with probably less food perhaps if you're slowing down.
That is true, and the studies have actually shown it. So everything is evidence-based, which we are talking here.
Yeah.
It's not a made-up stuff. So actually, when you slow down, you feel fuller sooner. And I have seen that with my younger one. He takes forever to finish his meal, and after a few bites, he's like, "Mama, I'm full." So, that happens all the time.
Yeah.
But anyhow, so, there are two important hormones which are gut related, serotonin and dopamine. So tell us more about like what is the impact of these hormones and how to activate them?
I think there are other gut hormones that I like to talk about, certainly. Serotonin and dopamine, I would say, I think there's genomic, tendencies for people. We can have genomic SNPs, etc., that can activate. I don't know that I would really have too much to say other than, at a deeper level, there's certainly a breakdown in terms of how these hormones are metabolized, how they're synthesized, etc. So, I like to talk about gut hormones in the sense of things like leptin and ghrelin and GLP-1 and peptides and things like that. I don't think beyond neurotransmitter production and breakdown, there isn't that much more that I could probably comment on without getting some diagrams out and some testing and things like that. Would you say that you feel like you are seeing this as a big component of your work with serotonin and dopamine?
Yeah, so these are also like the happy hormones, right? When we are talking about gut-brain axis, so a lot of depression, anxiety, and nowadays autism even linked with the gut disorders, right? And that means when you have a leaky gut, you have more toxins, and the gut-brain axis is disrupted. Those hormones, serotonin and dopamine, are the main hormones which are getting affected. Those are the hormones which make you happy, which make you control your emotions, and linked with any disturbance in those hormones are linked with depression, anxiety, and all that. But leptin and ghrelin, as you mentioned, are really getting more highlight in functional medicine world, right? So tell us more about them.
Well, I was going to circle back to what you were talking about, because I do think, when we're thinking of serotonin, dopamine, happy hormones, etc., we're also thinking of the microbiome and its responsibility and functionality in a lot of these things. So I don't know that we talk about gut health, but really we're probably talking about microbiome health,
yes,
functionality, and how it has so many functions. Like I love to remind people that our microbiome is like an organ. It may be an organ, and it weighs as much as the liver, so which is crazy. And so the functionality of it is just also that expanded. And so I think that because we have studies that are showing things like what you mentioned, autism, with studies showing the microbiota transplant and FMT, of course in mice to humans, but are humans to mice, and we're seeing these things. But it is pretty profound that this is a microbiota issue, perhaps not only intestinal and mucosal integrity, or not only genomics. I mean, we are looking at a lot of other factors, not just hormones, right? So
So what you're saying is it's totally controllable, it's totally reversible by taking care of gut microbiome, right?
I think preventable is a hard one in this day and age, because everybody's susceptible because of how we live to a toxic soup. Going from toxins in the environment and our soil and the way we eat and our stress, and all of these things contribute to lack of diversity, an impacted microbiome, multiple medications that we may be on, the pharmacology of those things. So I think, yes, I think now that we know a lot of this, I think for our kids and their kids, we're going to be trying to make some changes and really avoid a lot of this from happening in the first place. So, but you can't always avoid certain things that happen in life. You may get hospitalized. You may have your gallbladder removed. You may have certain insults to the way the north to south functionality of the GI tract work. And so then you have these obstacles that you're up against, and you have to work a little bit harder. So I don't know that it's always 100% preventable or 100% reversible necessarily. It by far it can be, but I don't want listeners to think, oh my God, this is all my fault, or this is all the fault of my parents or whatnot. It's a lot. We have some things out of our control.
Right. So, what do you think would be the most important thing they can do to preserve that healthy gut microbiome? Any actionable steps, like simple steps they can adopt in their day-to-day life?
Yeah, absolutely. I mean, food, nutrients, but that can be pretty tricky, because if you have pre-existing gut health issues, that can be nuanced. We see a lot of small intestinal bacterial overgrowth, gas and bloating when people are trying to eat healthy and eating super healthy unprocessed foods, lots of fiber, etc., but then get to a point, oh my God, I was eating all these foods and I can't tolerate them anymore. There's something that needs some exploration there and some diagnostics usually. But generally, if you're not having major gut issues, and I think the general rule of thumb is starting to reduce the processed foods, first of all, reduce that toxin exposure. Eating organic would be great, because you can get much less disturbance to the microbiome. But of course, you need to help that microbiome. You need to help with all natural, lots of plants. That doesn't mean you have to follow any specific diet. We're just saying a lot of the diets out there, really, most of them are there are plants in them. Now, there's a role for the carnivore diet sometimes, and there's a reason why it works. There's a role for certain diets that work there. These are all prescriptive diets. They mean to have a role for a person, usually in the short term. But in the day-to-day, most people will want to have plant diversity to help the microbiome function and let it do its job.
Yeah, decreasing the processed food is the big one in that. eating organic, healthy, local farmer food, local availability of the food, which is seasonal. And you just have to be mindful, like including like small things like yogurt or kefir, which has probiotics and prebiotics. They will help you getting that healthy microbiome.
Absolutely.
So, my daughter, was that?
Oh, no, I was going to say absolutely. Like thinking about going to the grocery store, or even if you're ordering on Instacart, like just typing in, vegetables or fruits you haven't heard of perhaps, or thinking of colors like red cabbage, purple, eggplant's purple, but they're purple tomatoes, whatever you can be thinking about, because you do want the polyphenols as well, which are the colorful antioxidants and other types of bioactives that these fruits and vegetables have, and other plant foods as well. So I like to think of like, try to aim for 30 to 40 diverse plant foods in a week. That doesn't mean, again, you're not giving up the protein and the high quality fats and those things either, but we're just trying to diversify and help you stay diverse. I said the word diverse way too many times in this conversation, but you may say, oh, I live in a food desert, or I can't afford the organic. That's okay. Well, at least get the variety if you can. And remember, some of these plant foods are fairly inexpensive when they come in a bag, like dried legumes and lentils. And again, if they bother you, that's another story. They bother you because of something going on. So that needs to be important.
Right. And, I was telling my daughter got little, cold-like symptoms, and then she was starting producing greenish phlegm and was having like low-grade fever. So I started her on antibiotics, and with that, I'm giving her some probiotic additional supplements to help her with the gut bacteria, because many times, people take different medications, whether in the form of antibiotics or over-the-counter meds, and those medications, they interfere with your natural healthy gut bacteria. So you have to incorporate either yogurt, kefir, or some supplementation with the probiotics to help you with the gut bacteria.
That's right.
And many times, people like in hospitals, they have low immunity and they catch more infections. So can you talk about like how microbiome is improving the immunity or immune system, boosting your immune system?
Oh, okay. Yeah, you mean the gut immune system. Yeah, so not related to being hospitalized. I think, the microbiome is again responsible so far as we know. There are other factors, but the microbiome is the one that's modulating the immune system. So there is some immune activation at a cellular level, without getting too nerdy. Like I'm not totally well versed on speaking on the immune system, but we're talking about helper cells and that kind of immune modulation happening at the lining of the gut. And so, responsible for developing oral food tolerances, etc. So we think of like, at least in our functional medicine training and, even non-functional medicine training, like naturopathic training, etc., old traditional medicinal philosophies know that when we have a food sensitivity or a food intolerance, that is an immune reaction, right? So why is the immune system being revved up? Why is it reactivating? So these are things that you want to question and wonder, what type of immune reaction is happening for which type of food intolerance, because these are different than food allergies, food sensitivities, food intolerances. And so, that alone tells you, like, if you're just a layperson, you're like, what is the good gut immune system? It's just when you eat a food and you have a reaction to it that might be like, a skin rash or, something like that. That is a immune response, right? So we know that is definitely something that we know more about than we did. I think when I went to school, I wasn't taught about that whatsoever, because in conventional medicine, we're all taught to be separating. You're the kidney doctor, you just deal with the kidney, right? I deal with the GI tract, and sometimes even GI isn't talking to hepatology. So even though it's connected, so it's like, it's completely parsed out, and that's how you're trained. So you need that because you get really good at those organs. You're really good at your, being a nephrologist, and everything about that. And GI here, and what's another example? Bone marrow transplant doctor, etc. But everything is talking to each other, and so that's why I think,
you are right on the target. So that reminds me about a story of a patient I had a couple years ago. She was on hydralazine, so it's the blood pressure medication. Mm-hmm. So she came to me because of the kidney failure, but she had a history of GI bleed for years, like 2 years prior to coming to me. And when I got her, she had like close to about 15 transfusions in the last 2 years. That is the amount of GI bleed she was getting. So I started testing her for vasculitis, and surely she was positive for ENCA. And it's a small vessel inflammation, which was caused by the antibodies her body was producing against that medication. And those antibodies were fighting with her own cells as well. It's an autoimmune reaction she was getting, and she started having GI bleed. Wow. And then she started having kidney issues. So when we did the kidney biopsy, we found out there's a lot of inflammation going on, and NCA levels were very, very high. And that's how, it made me to look into the antibodies, and we found she has, antibodies positive for hydralazine. So what we did is just to take her, we took her off the hydralazine, and in 2 months, she was much, much better. She did not require any transfusion. So that's the power of looking at the root cause of the problem. And as you said, everything is actually talking to each other, right? So once, we in conventional medicine, we are so like compartmentalized. We are looking at only one organ at a time. But if we put together all the dots, we can actually frame the whole picture of the human body and see actually what's going on. So that's a very powerful message. I'm sure in your practice also you are using elimination diet or food sensitivity testing. So is there any strong clinical evidence supporting these measures for the gut disorders?
Well, yeah, I mean, there's a classic one that, the SFED or SPED, or however you want to say it, for EOE, so it's eosinophilic esophagitis. So that's very much in the guidelines to be used, and that's a very specific 6-food elimination diet that you can do step down or bottom up, depending on how you're looking at it. So yeah, I mean, these are different types of elimination diets that are used. I think our functional medicine, functional nutrition, etc., integrated medicine type of approach to the elimination diet is not used enough in conventional medicine. It is a great tool. It is free. It's a little hard to do for sure, but it only has to be done for a shorter amount of time. It's almost like a detox, if you will. So, a lot of times people in January say, oh, I'm going to do a Whole30. Well, that's what you're doing. You're doing an elimination diet. That's almost the same thing. They're parallels. So I find it to be a great tool. And honestly, you end up just eating a lot of plants and proteins and good quality fats. So you're kind of, that's what you're doing because you're avoiding some of these pro and inflammatory foods. Now, that doesn't mean you have to be off of these foods all the time. They're not pro-inflammatory all the time in smaller doses for some people. Does everybody need to be, soy-free, corn-free, dairy-free, gluten-free, etc.? No. But, at times people do feel that is a nice way to detoxify, to reset, to allow the inflammation to go down, if you will. So I'm a big fan of it. I don't do food sensitivity testing unless we get to a point where we need to, and actually we end up in our practice, we don't usually have to do that.
Yeah, even for like Metabolic Reset program, which I launched last year, I was actually doing elimination diet on myself. I was getting brain fog in the middle of the day and I was feeling very sleepy. I found out dairy was making me sleepy. So when I eliminated dairy from my diet, it actually gave me more energy. So that brain fog was gone. So you might get symptoms beyond your gut if you are sensitive to certain foods, right?
Mm-hmm. Yeah, and so you'll make a decision when you're going through this, if listeners are listening, like, is it worth it? Was it worth it, like, to have those symptoms when I put them back? Or that's what I hear a lot of, and this is in conventional GI too. Try being off of gluten and dairy for a month, and it may be done, and people come back and say, that when I brought that back in, I felt way worse systemically, like I had joint pains and it's brain fog, like you said. It's not worth it to me to go back on it again, that even if they didn't have celiac, right? So I mean, I think it's a worthwhile test,
Yeah, definitely. So what would you say, how the gut health is related with longevity?
Okay. Kind of indirectly, but also directly. We do have some data on aging, particularly with the microbiome that I've been digging into in some of the microbiome coursework I'm in. But I guess, if you think of it perhaps more indirectly, so you think of it being a real great metabolic tool. I mean, this is why we have GLP-1 drugs now that are helping with blood sugar and weight, which then help your metabolic health, right? So, So I think, really it's via probably the metabolic pathways, the blood sugar pathways, the insulin resistance pathways, the metabolic function that I was talking about in the beginning, in the sense of like, what does the microbiota do? It's producing, we need butyrate as a production and butyrate as a fuel for the colon cells. So this is all metabolic terminology that we're using here. There are, certain supplements out there that are byproducts, if you will, of the microbiome. So urolithin A is a big one. It's touted as a longevity supplement, and it happens to be very expensive, but it is a byproduct of the microbiota processes. So I think that there is a big role of I guess in general, let's say gut health and longevity. And there are a few aspects I'm missing that I'm not coming up with right off the bat here. But yeah, that's in a nutshell what I would say.
But I think, as you said, the metabolic thing is the big, determinant of your age. If you have metabolic disorder early on, that leads to, atherosclerosis and calcification of your vessels and cardiac diseases and, the snowball of other problems. So all chronic diseases, pretty much, they originate with the metabolic disorders, and all the metabolic disorders start from your gut, right? So in a nutshell, that's how I perceive it. And if you have the better gut microbiome, you have, taken care of your leaky gut, if you're eating healthy, if all the gut-brain axes are aligned, your hormones are aligned, that leads to better metabolic outcomes.
Yeah.
And that leads to your longevity.
Right.
So that's indirectly related. You're very much right.
But there are there's the populations that do all of those things that don't have subjective gut issues, that still have dyslipidemia, blockages in their heart, and pre-diabetes or diabetes. So there's still so much more about metabolic health that is not necessarily only gut health, right? So
you're right.
We see
right.
that.
In most of the, what we see in the epidemic of obesity is originated because of the bad lifestyle in America, right? So we are talking about the majority, but of course there are other factors which are involved with your metabolic health, and that may be your epigenetics, your genes, and various other things which might be happening. But majority of people, they are getting all those chronic diseases, and even the kidney problems, starting with all the inflammation and the cytokine storm in your blood and all the metabolic dysregulation. So
it is the majority. You're right.
You mentioned about the short chain fatty acids like butyrate, which is produced by the gut microbiome. So you touched upon a little bit about how it affects the metabolic and cellular health. So those are the things which we have to be mindful about. Anything in the last comments you can give any tips to our viewers and to improve their gut health overall?
Yeah, I mean, I think try not to, if you think you're getting enough fiber, think again. I would probably consider some objective measurements to look at that. You can do like tracking on Chronometer to see them. That we have a little really cool small intake form that we do where we can do it without you having to weigh your food. But both of those kinds of tools really give you an idea of, oh my God, am I getting the 35 to 45 grams of fiber a day? So consider an objective way to measure, unless it drives you crazy or, unless there's an unhealthy food relationship, then I don't advise something like that. I think, be thinking outside the box of fiber too. There's different types. There's, soluble, insoluble, but resistant starch is a big one that people don't really talk about, even in functional medicine. There's a whole list. You can Google it. Resistant starches. There's all kinds of cool things in there. Flours out there that you can play around with, chestnuts. I mean, there's a cool list of resistant starch heavy foods. So be thinking about those because those are really great for the metabolic pathways for the microbiota. We do have a fiber mini course that does go over that. So I don't think I have that in my LinkedIn profile, but find us, and we can get that to you. I would say, get in the dirt. I'm not good at that. I have a dog. I think that helps diversify, but I don't garden because I just kill everything. But that is a goal for me. I want to start getting into the garden. I think that's really, really important. Being outside in nature, getting in nature is a great way to do this. And then, be judicious with antibiotic use. You may need it at some points. Ask your provider, do I really need this? What are the consequences if I don't take it? What can I do while I'm on it? Those are some things. And it's not just antibiotics. There are some other medications too to be thinking about. So
wonderful.
Thank you for having me.
Thank you so much. We had a lot of fun, and I'm sure viewers have taken a lot of nuggets from you. How they can reach you?
Well, I'm on IG as you are right now, Precision Gut Health. Also same with Facebook and TikTok. And then our website is precisionguthealth.com. There's a lot of good information there. And there's some free stuff on our link in the profile on Instagram. There's some cool stuff. We've got a webinar coming up on hormones, another webinar on glucotypes, some other great stuff. There's a real good special on Prolon. So all kinds of little things that you and I could talk about all day.
Wonderful. We need to do another session soon.
Let's do it. Yes. Thank you.
All right. Thank you. Good night. Take care. Bye-bye.